Hi, my name is Dr. Felicia Ekpo, and I am a board-certified dermatologist and hair transplant surgeon. From the age of 2, I feel like I'm just like my 2-year-old daughter. I always knew I wanted to be definitely a doctor. I was playing with all of my doctor toys. I always wanted to heal everybody. I wanted to fix people. When people were sad, I wanted to make them happy. But then as being a dermatologist, that came from when my sister went to Nigeria to visit my grandmother, and unfortunately, she got sick with typhoid fever and unfortunately passed away. I still remember the night when she called me and told me that she had red spots all over her body. And the doctors there didn't know what it was. No one really knew what was going on. And especially when it comes to skin color, things present differently, things appear differently in the skin. So I knew that at that moment I wanted to be able to be a dermatologist so I can see what's going on internally and then be able to use those internal manifestations to see what is going on in the skin to help other families from experiencing what my family and I had to go through. So it's been a wonderful opportunity to be a board-certified dermatologist because even when it comes to the hair, I can see what's going on internally. I can see what's going on with your A1C and your glucose. I can see what's going on with your kidneys and your liver, and then also throughout the skin as well too. So yes, I've always wanted to be a board-certified dermatologist. As far as what attracted me to hair transplants, it is because I love hair loss disorders and everything about it. Hair loss is actually a subspecialty in dermatology, and not many people are as knowledgeable as the level I am because I actually sought out to do more training and more research in this at the Cleveland Clinic, and then also did hair transplant training in Chicago. Now I did this because I wanted to be able to answer all the questions for my patients and also give my patients the best treatment that they need, whether it's a non-surgical treatment or a surgical treatment.
So when my patients get a hair transplant, I want my patients to get one confidence. So our slogan is restoring hair, restoring edges, restoring confidence. When I see patients, they usually come in and they're not as confident because they're having their hairline receding, they're losing their edges, they're losing portions of their hair that they didn't have maybe even a few years ago. And the worst part of it all, they're losing hope. They've been to different hair transplant surgeons, they've been to different doctors, and either one, from what my patients tell me, they either didn't really care, or two, they weren't comfortable. And when it comes to Afrocentric hair, a lot of the surgeons, especially in this area, they're not skilled in doing Afrocentric hair transplants because of our specific curl pattern. So those patients lose hope. So when they come to me, I like to reassure them that we can do this. I've done plenty of these. I can almost do it in my sleep because it's that much fun and I do so much. So after the procedure, I want to see that smile on their face and that hope restored, because I'm not just there for that transplant. I'm there for them every step of the way, from that day of the surgery to that year mark to that 18 months. And then even after that, I'll continue to be their doctor for as long as they want me there.
I make sure that my patients trust me after a hair transplant procedure, or any procedure that I do for that matter, by one, being very transparent. Everything that I do, I make sure that they know from start to finish. From their post-operation packet, they will have videos, they will have resources so that they will understand everything that I've said in different formats, video format, written format, and they'll even have access to myself and my staff as well too. Expectations, clear expectations, are also one of the big components to forming a wonderful physician-patient relationship. So as long as I understand that their expectations are met and we're on the same page, clear communication, then that also builds a healthy, trusting physician-patient relationship. What makes me different from other hair transplant surgeons in the area is that I am not only just a hair transplant surgeon, but I am also a board-certified dermatologist. As a hair transplant surgeon, typically, sometimes they're plastic surgeons, so they're not skilled in the dermatological manifestations of the hair loss disorders. And so, but as a board-certified dermatologist that also has additional training in hair loss, I can also treat the scalp conditions that are seen when it comes to hair loss. And you need to know that because you have to determine if your patient is the right candidate for a hair transplant. So in order to diagnose that and make sure that you're a perfect candidate for a hair transplant, using my skills as a board-certified dermatologist, just with additional training at Cleveland Clinic on hair research, I equip that with my knowledge with the hair transplant surgery to, one, treat those pre-existing scalp conditions and then give my patients the best hair transplant result. afterwards. I want my patients to feel fulfilled after they receive a hair transplant procedure with me because one, their goals are met, their confidence is starting to be restored, and their hope is renewed. I want my patients to feel like they are more relaxed. As some of my patients have told me, wow, this felt like a spa day. They felt pampered from when they checked in to when they left with my team, taking their shoes off, putting on their blue foot covers, to them getting to choose whatever they want to eat for lunch, to them being escorted to the restroom, front, back, front, all the above, so they can really enjoy the day. A lot of my patients feel like royalty whenever they get a hair transplant procedure because they've never had that many people catering to their needs. So after they leave, I want them to feel, wow, I did this and it was worth it. My patients see results in as early as 3 months after a hair transplant procedure. I tell my patients that it is normal to lose the shaft, which is the top of the hair that sticks out from the scalp, after the procedure because the root is forming into that new blood supply. And then after that, the hairs fall out. Now the root is trying to then take root to that new blood supply and then grow. After that, you start growing your hair. I also equipped my hair transplant patients with hair growth, so my hair growth serums and options to also increase faster growth if they are a candidate for that as well too. That also helps my patients to grow their hair faster and sooner. So my patients are very surprised sometimes when they don't even experience the shaft falling out after the procedure. So with the way I do it for my patients, they're extremely happy with their growth. Not everybody is the same. Everyone's hair grows differently and everyone's hair grows at different speeds as well too. So I tell my patients to be patient as well too, because you have to wait at least a year to 18 months to see the most optimal results. And then for my patients with scarring hair loss, it does tend to take a little bit longer, along with the treatment interim between the checks every 3 months as well too. If you're interested in hair transplantation, you can get a hold of us by going to our website, which is www.thedoctoredges.com, and by calling 469-809-HAIR.